I'm Michelle Strode and I work for Disability Action based in Dorset, and I'm a physiotherapist.
And I'm Caroline Chandler, I'm the lead MS nurse specialist at Poole Hospital.
The two teams basically work together in that the service at Poole Hospital sees people from diagnosis and through the first stages of disease, and when somebody goes into the latter stages of more progressive disease and needs more symptom and disability management, they're transferred over to Disability Action. We saw the advertisements by the MS Trust, and also we were lucky enough to have Amy Bowen and Vicky Matthews visiting Dorset at the time, and we thought it would be a brilliant opportunity for us.
We knew within the current financial situation of the NHS that we needed to quantify our roles, and the GEMS project seemed to give us the perfect opportunity to give us extra resources to enable that to happen.
We hope not only to have tools to be able to evaluate our services, but also the experience and the skills within ourselves to be able to do that as well. And I think the whole experience of GEMS, we thought at the time, would allow us to do that.
Do it.
Overwhelmingly do it.
Yeah. Do it. It's hard work, and you have to be motivated, but the results you get at the end of it are absolutely fabulous. Far greater information than you could ever achieve on your own.
I think as well it's about, like we were saying, it's about having the skills and having the confidence to be able to look at your service in this way, as well as having the tools. And certainly I've gained a lot more of that than I thought I would have done when I applied, and also the getting together with like-minded people, because all of the teams that were involved in GEMS, none of the services were the same. There were very big teams, small teams with one nurse, rural, urban, the whole variety, but we managed to come up with process indicators and have agreement on a lot of things that I think even the people facilitating GEMS didn't know whether that was going to be possible in the beginning. And I think the enthusiasm, the passion, kind of gives you all a boost, and this is the right way to go. I think from a patient perspective, what it will mean is it will mean that a service will be responsive to them and be the most efficient and robust that it can be. And this will go alongside other evidence-based approaches to their management or treatment, but it means that the service that they actually have will be as good as it can be for them, and they will know that it's having a process where it is being evaluated and checked.
But also it's their way of feeding back to us. Are you doing the right thing for them? I don't think it was a particularly difficult process for us, in that we were aware of the gold star service that we wanted to offer people with MS, so our targets were, or indicators were, very much aimed at areas that we believed were important to people with MS, that we wanted to measure our service against. I suppose we had to look at processes as to how you were going to collect that data, and certainly some of the processes we had to change within our team to ensure we did collect the data that we needed. Some of it before was a bit more haphazard.
I think it has taken more time. We'd be fibbing if we said it wasn't, but I think we can see the value of being able to evidence our work, and without this, who knows where our services will be in the future. So I think the time out that it's taken to be able to achieve the data collection has been well worth it.
We'd want it to be ongoing. Like I say, we were committed to data collection. We've now got a very robust way of collecting data, and I think it's about carrying that on. It's not just for a 12-month period.
We'd be mad not to, really. I think being able to stratify the caseload has been really useful in that in your mind you kind of know the demographics of your caseload, but to actually have it there in charts and graphs, it kind of solidifies things, and also you kind of breathe a sigh of relief because you know that what you've been thinking is actually right and you've now got the data to prove it. Sure. It meant that we could actually analyse our caseload and analyse our activity in an efficient way. I think before then we were collecting a lot of data and we were able to provide some evaluation of our service, but not as fully as we were able to with the tools that were developed through GEMS. I guess we're in the process of writing the reports at the moment, so when those reports are completed they will then be taken to managers, and certainly when we're talking about process indicators we aren't meeting them all and we wouldn't expect to have met them all, so it's looking at whether the services need to be redesigned or things need to be altered very slightly, processes changed in order to be able to achieve those. And for managers to have a clear idea about what we're doing and what the service aims are and have a clear direction, I think that's what it will give us.